Naturally, the third line of defence commences after the first and second lines have been penetrated and pathogens have invaded. Antigens are responsible for alerting the body of an attack. However, the pathogen requires an antigen to infect the host. The antigen can be a fat, a carbohydrate, a protein, or a nucleic acid. Adaptive or specific. The immune system governs the best way to attack an invading antigen and activates an advanced system to aid the recognition of the antigen should it strike again. The behaviour of acquired immunity is to learn which antigen has entered the body, familiarise itself with it, with the foreign substance, and remember it in the event of future invasion. Antibodies are then stimulated and remain in the body until such an occasion. Acquired immunity is unseen at birth and is something we learn as we develop and are exposed to our natural environment. Our immune system then produces a reaction to foreign substances it has encountered, and here the foreign substance are antigens. Hypersensitivity. Hypersensitivity to antigens is described as an overreaction or an excessive reaction produced by the regular immune system after repeat invasions, and these can be viewed in 4 varieties. Type 1, the reaction generally takes between 10 to 30 minutes after antigen exposure. However, delayed onset would take approximately 10 to 15 hours. Symptoms contrast from minor inconveniences to fatalities. Type 1's response include eczema of the skin and conjunctivitis of the eyes, and is also referred to as anaphylactic hypersensitivity. Type 2, antibodies act in response to antigens that are located on specific cells. The complement system releases target cells, destroying enzymes activated in these antigen antibodies. These specific cells could be potentially healthy cells, natural component, or indeed foreign microbes, induced infection or drugs. Type 3, seen when an individual has a highly sensitised reaction to a specific antigen, then the individual becomes exposed to the antigen. The antigen-antibody complex bonds to the lining of small blood vessels, prompting the complement system to become active, producing an anti-inflammatory reaction. And type 4, a T lymphocyte reaction as opposed to antibodies. And this is seen in thyroid inflammation, Hansen's disease, and organ transplant rejection. So now we have immune system cells, innate and adaptive. Innate immunity is already present in the body, however adaptive immunity is the response after exposure to foreign substances. Adaptive immunity remains in the body throughout one's life, with B cells and T cells composing the adaptive response. So to begin, mast cells. These cells recruit neutrophils and macrophages, generated inflammation via vasodilation and histamine release. Mast cells defend against pathogens and aid wound healing, although it can be responsible for allergic reaction. Natural killer cells circulate through the bloodstream and into tissues, killing infected cells and also tumour cells. Next is macrophages, phagocytic cells which consume cancer cells and foreign pathogens by stimulating various immune cells. Macrophages migrate into tissue from blood vessels. Monocytes journey through the blood vessels to infect tissues and are stored in the spleen. Monocytes transform into macrophages and dendritic cells responding to inflammation. Neutrophils, they release inhibiting or killing toxins towards bacteria whilst recruiting other immune cells. Neutrophil are primary responder at the site of infected infection or trauma. Eosinophils circulate the body in the blood and migrate to tissues. Parasites and bacteria killing toxins are then released, and this can however result in tissue damage. And basophil, they migrate through the blood towards tissues, defending against pathogenic invaders such as parasites. And basophil release histamines, causing swelling. So adaptive, this is done through B cells and T cells. B cells are derivative from bone marrow manufacturing antibodies. These antibodies stick to antigens, creating clusters which alert the body of intruders. The body begins the production of toxic substances used to fight the antigens off, and these cells are phagocytes which submerge the intruding antigens and abolish them. So B cells are lymphocytes, which are small white blood cells, and the antibodies produced are Y-shaped proteins. Their function are to produce antibodies and to chaperone antigens to T cells, and furthermore activate the T cell. Next is T cells, recognisers of antigenic invaders, which release cytokines throughout the immune system. T cells can then aid B cells in the creation of antibodies, however they can also directly destroy virus-affected cells. So the T cells are also lymphocytes, which mature in the thymus. B and T cells are both crucial for antiviral defences. The function of the T cells are to signal growth and B cell activation, to alert the cells of foreign substances, cytotoxic release during a viral infection, and signal growth in various T cells, macrophages and eosinophils. Immunoglobulins are glycoprotein particles constructed of single and multiple components which each home 4 polypeptide chains, 2 equal heavy chains as well as 2 equal light chains, producing a tight bilaterally symmetrical formation. Immunoglobulins are protein molecules formed by mature B cells in response to foreign proteins in the body, and they are also referred to as antibodies. The key varieties, there are 5 key varieties of immunoglobulins, and they are distinctive by the type of heavy chain within the molecule. IgA are alpha chains, IgD delta chain, IgE epsilon chains, IgG gamma chains, IgM mood change, and the 2 light chains consist of only 2 chief varieties. They are kappa and lambda. IgA are a chief responsibility in the first line of defence in mucosal surface infections found in bile, respiratory tract secretions, saliva and intestinal tract secretions. IgD are located on the exterior surface of B cells with an uncertain role. IgE are found in a person with allergies. An example is anaphylactic shock. IgG is the most abundant, representative of an estimated 80% of protein, initiating the activation of the complement system. A lone immunoglobulin capable of crossing the placenta, in addition to the key element of passive maternal antibody transfer via colostrum, hence its high quality of antibodies. IgM, principal antibody formed in the primary immune response, representative of approximately 20% of serum antibodies. IgM acts as an antitoxin contrary to snake venom, diphtheria, anthrax and tetanus. And kappa and lambda neutralise bacterium and virus threats within the body. Next, the immune system's ability to self-identify self and non-self cells is due to the special characteristics of its antigens. They secure non-self cells of an attack. The National Library of Medicine 2019 explained the histocompatibility complex gene group provides instructions for making a group of related proteins, known as the human leukocyte antigen, HLA complex. The HLA complex helps the immune system distinguish the body's own proteins from proteins made by foreign invaders, such as viruses and bacteria. Complexes MHC1 and MHC11 are key factors in addition to human leukocyte antigen gene complex, permitting the immune system to differentiate between self cells and non-self cells. Histocompatibility complex genes exist in a variety of variations, enabling every individual immune system to respond to a variety of foreign invaders. However, many MHC gene functions are unknown. Nucleated cells have an MHC1 molecule situated on the exterior, acting as an alarm system to the immune system. Any unrecognised proteins on its surface will be broken down and revealed, allowing the T cells to recognise these as foreign invaders. And similarly, MHC11 molecules are available to particular cells rather than nucleated cells. Foreign proteins are also broken down and digested by phagocytes, collected by T cells and attacked. Transplant organ rejection. The immune system is a complex organisation of biological processes defending the body of pathogens. However, it is also a challenging obstacle for the procedure of organ transplantation. Organ transplantation takes place when an organ is failing or when a physical condition needs correcting, the most common organ being the liver. The immune system has developed an active mechanism towards the invaders which do not belong within the body. thus prompting the rejection of a transfusion of blood or an organ transplantation. Tissue typing concludes whether the organ or tissue is compatible with the recipient, which are not always a match. Particular T cells are stunned during and post-surgery by monocular antibodies to prevent organ rejection, and without this process the immune response would activate an attack on the unrecognised tissue. These come in three types of rejection. Firstly is hyperacute. Normally is onset within 48 hours. The symptoms are high fever, discomfort and graft tenderness. All symptoms shown together, they prompt an immediate removal of the organ. Next is acute. Acute takes place from 7 days to 2 years after the transplantation. Some symptoms are the kidneys failing to produce urine and urea, or at least a slow urine output. High temperature, fatigue, raised blood pressure, and increased urea nitrogen in the blood, and also creatinine. And lastly is chronic. Chronic is a gradual process that can actually take months or even years. The symptoms are raised blood, urea, nitrogen and creatinine, fatigue, proteinuria, which is excess protein in the urine, and electrolytes imbalance. And lastly, two diseases that we can view are multiple sclerosis and lupus. So multiple sclerosis is a lifelong condition capable of developing at any age that can impact the brain and or spinal cord. More commonly seen in women, MS causes a variety of complications from mild to serious disability. Multiple sclerosis is a progressive condition with an assortment of symptoms. They are lethargy, struggled mobility, distorted vision, incontinence, lack of feeling in body parts, muscle stiffness and tremors, instability and coordination, and also confusion. Caused by the destruction of healthy cells, which have been mistakenly attacked, the immune system attacks the myelin sheath, providing the protective layer of the nerves. Due to this destruction, the messages travelling along these nerves become slower and disturbed. Treatment for this condition includes short course relapse medications with particular treatment for specific MS symptoms, as well as this, disease modifying therapies are used in an attempt to reduce the amount of relapses. And lastly, lupus is a lifelong condition affecting the skin, joints and other organs with inflammation or swelling. Stiffness and joint pain, fatigue, weight loss, rashes, commonly over the nose and cheeks, gland swelling, light sensitivity and poor blood circulation in the fingers and toes. The body demonstrates an attack on healthy tissues and organs within, and this triggers inflammation ranging from minor to severe. Ibuprofen medicines are an anti-inflammatory which can be bought over the counter but also prescribed. And steroids are often required for the dilation of the kidney or rashes. These can be administered orally or via injection, and hydrochloroquine is also administrable for the skin, for problematic joints and also for fatigue.